Pregnancy after the age of 35 is becoming more common as women are waiting longer to start families. While it is possible to have a healthy pregnancy and baby at this age, there are some important considerations and tips to keep in mind. One of the first things to consider when thinking about pregnancy after 35 is the increased risk of certain complications. Women over the age of 35 are more likely to experience issues such as high blood pressure, gestational diabetes, and chromosomal abnormalities in the baby. It is important to discuss these risks with your healthcare provider and make a plan for monitoring and managing any potential complications. Another important consideration is fertility. As women age, their fertility naturally decreases, making it potentially more difficult to conceive. If you are over the age of 35 and trying to get pregnant, it may take longer than it would have in your younger years. It is important to be patient and seek help from a fertility specialist if needed. Once you do become pregnant, there are some tips to help ensure a healthy pregnancy and baby. First and foremost, it is important to take care of yourself. This means eating a healthy diet, getting regular exercise, and avoiding harmful substances such as alcohol and tobacco. It is also important to take prenatal vitamins and attend all prenatal appointments to monitor the health of both you and your baby. As you progress through your pregnancy, it is important to be aware of the increased risk of certain complications. Women over the age of 35 are more likely to develop conditions such as preeclampsia and gestational diabetes. It is important to be vigilant about monitoring your health and seeking medical attention if you experience any concerning symptoms. Another important consideration for women over the age of 35 is the increased risk of chromosomal abnormalities in the baby. As women age, the risk of having a baby with conditions such as Down syndrome increases. It is important to discuss these risks with your healthcare provider and consider options such as genetic testing to assess the health of your baby. Despite these considerations, many women over the age of 35 go on to have healthy pregnancies and babies. It is important to stay positive and focus on taking care of yourself and your baby. Surround yourself with a supportive network of friends and family who can help you through this exciting but sometimes challenging time. In conclusion, pregnancy after the age of 35 is becoming more common, but it is important to be aware of the potential risks and considerations. By taking care of yourself, seeking help from healthcare providers when needed, and staying positive, you can increase your chances of having a healthy pregnancy and baby. Remember that every pregnancy is unique, and it is important to listen to your body and seek help if you have any concerns. With the right support and care, you can have a successful pregnancy and welcome a new addition to your family.